Hello and Assalamu alaikum. Ultrascan Diagnostics. So this is the CBCT of the patient which you had requested. The area of interest is lower right, upper right for posteriors for fracture evaluation. This is going to be considerably difficult because we need to know exactly which tooth is in question or which tooth the doctor is suspecting as to be the problem. Starting with the lower right side, which is this side. So we've got two teeth in question, the 7 and the 6. Now the 7 does not show any signs on occlusal view, no PDL widening can be seen. Slight bit of a periapical radiolucency on the mesial aspect, not periapical, sorry, periradicular radiolucency on the mesial aspect. Nothing very significant. We'll match that with the transaxial view, and nothing very significant can be seen here. There you go. Very slight bit of a line on the mesial aspect can be seen, but we can't be very certain. Clinical correlation is needed right here on the lower right 7. Apart from that, the lower right 8 does not show any signs. Moving to the upper right segment, we've got an endodontically treated tooth. There you go. And the upper right segment also does not show any significant periradicular signs of cracks. The upper right seems to be extremely clear. No fracture. We've seen the lower right 7, however, does show a slight bit of a line. The upper right 8 um, is not impacted and has fused roots close together. No sinus perforation, no periapical radiolucency. Now moving to the lower left segment where another fracture awaits. So we've got the 5, 6 which are endodontically treated. The 7 has a crown. As you move further down, the problem with crown teeth is because of their very radio opaque material covering the crown. It's very hard to see cracks or fractures in the crown. However, the root area on the lower left, only tooth which shows slight bit of a PDL widening is the lower left 7 on the mesial aspect right there. Clinical correlation is right. It could be a periodontal problem, it could be an endodontic problem, it could be a periodontal problem. Doesn't seem like a crack or an endodontic problem. But the lower right 7 definitely shows us some line and some signs can be seen of a crack on the radiolus on the radiograph.